Top 25 Child Safeguarding Interview Questions and Answers. Child safeguarding is crucial in protecting children from harm, abuse, and neglect. These interview questions and answers will help you prepare effectively and confidently. 1. What is child safeguarding? Child safeguarding refers to the policies, procedures, and practices designed to protect children from abuse, neglect, exploitation, or harm. It ensures children's physical, emotional, and psychological well-being. Organizations implement safeguarding measures to create safe environments in schools, care centers, and communities. Staff must be trained to recognize risks, report concerns, and act in the child's best interest. Safeguarding is proactive and preventative, focusing on maintaining safety rather than only responding to incidents. It also involves creating clear boundaries, providing guidance, and promoting awareness among children and adults to ensure protection in all aspects of their lives. 2. How do you recognize signs of child abuse? Recognizing child abuse involves identifying physical, emotional, sexual, or neglectful signs. Physical abuse may include unexplained bruises, burns, or injuries. Emotional abuse can manifest as withdrawal, fearfulness, or low self-esteem. Sexual abuse may involve inappropriate sexual behavior or knowledge beyond age. Neglect shows through poor hygiene, malnutrition, or inadequate supervision. Behavioral changes, sudden aggression, or school absenteeism are also warning signs. Staff should observe children carefully, maintain open communication, and listen attentively to disclosures. Awareness of cultural and developmental differences is essential to avoid misinterpretation. Prompt reporting ensures timely support and protection for the child. 3. What are the key principles of child safeguarding? The key principles of child safeguarding include prioritizing the child's welfare, preventing harm, and promoting well-being. Organizations should have clear policies, safe recruitment, and trained staff. Confidentiality, transparency, and accountability are essential in all interactions. Empowering children to express concerns, listening actively, and responding appropriately ensures their rights are protected. Safeguarding also requires regular risk assessments and continuous monitoring. Collaboration with families, communities, and external agencies strengthens protection. Every decision should focus on the best interests of the child while respecting diversity and equality. Effective safeguarding practices balance vigilance with support, creating a safe and nurturing environment. 4. How do you handle a disclosure from a child? When a child discloses abuse, it is vital to remain calm, attentive, and non-judgmental. Listen carefully, allow the child to speak freely, and avoid interrupting or pressuring them. Reassure the child that they are believed and not at fault. Avoid asking leading or suggestive questions that could influence their account. Record the disclosure accurately, including dates, times, and details, while maintaining confidentiality. Immediately report the disclosure to the designated safeguarding officer or appropriate authority. Provide support and reassurance, explaining the next steps. Following organizational procedures ensures the child's safety, proper investigation, and access to professional help. 5. What is the difference between safeguarding and child protection? Safeguarding is a broader concept encompassing measures to promote a child's overall well-being, prevent harm, and create safe environments. It includes policies, procedures, and training that support children's development and safety. Child protection is a specific component of safeguarding, focused on responding to children at risk of or experiencing abuse or neglect. While safeguarding is proactive, child protection is reactive and intervention-based. Both are interdependent, as effective safeguarding prevents abuse, while child protection ensures timely action when abuse occurs. Organizations must implement safeguarding policies while having clear procedures for child protection to protect children effectively. 6. What steps do you take to ensure a safe environment for children? Ensuring a safe environment involves risk assessments, clear policies, and staff training. Physical safety includes secure facilities, safe equipment, and supervision. Emotional safety involves promoting respect, empathy, and anti-bullying measures. Staff should be vetted through background checks and undergo safeguarding training. Clear procedures for reporting concerns, boundaries, and conduct must be established. Policies should cover online safety, emergency response, and first aid. Children should be encouraged to express concerns and know who to approach. Continuous monitoring, audits, and regular reviews ensure compliance. Collaboration with parents and community members strengthens protective measures, creating a supportive environment. 7. How do you respond to allegations against a staff member? Responding to allegations involves following organizational safeguarding procedures immediately. Ensure the child's safety first, and separate the accused from contact with children. Maintain confidentiality and document all details accurately. Report the allegation to the designated safeguarding officer or local authority. Avoid investigating personally to prevent evidence compromise or bias. Cooperate with external agencies, such as Child Protection Services or the police, as required. Support both the child and staff involved. Ensuring access to counseling if needed. Transparent communication and adherence to policies protect children, staff rights, and the organization's integrity. 8. How do you promote awareness of child safeguarding among staff and children? Promoting awareness includes regular training, workshops, and clear communication of policies. Staff should be informed about signs of abuse, reporting procedures, and their responsibilities. Children should learn age-appropriate information about safety, boundaries, and trusted adults. Visual aid, discussions, and interactive sessions increase engagement. Policies should be accessible, and guidance should be reinforced consistently. Encouraging open dialogue helps staff and children feel comfortable reporting concerns. Leadership should model safeguarding practices and integrate them into organizational culture. Regular evaluations and updates ensure the awareness program remains effective, responsive, and relevant to changing risks. 9. What is your approach to risk assessment for children? Risk assessment involves identifying potential hazards to children's safety, evaluating their likelihood, and implementing measures to reduce them. This includes physical, emotional, and environmental risks, as well as online safety concerns. Staff should consider age, abilities, and vulnerabilities when assessing risk. Collaboration with parents, colleagues, and external professionals strengthens the process. Regular reviews ensure changing circumstances are addressed. Documentation of risks, mitigation strategies, and monitoring is essential. Risk assessment should be proactive, aiming to prevent incidents before they occur. By balancing vigilance with support, organizations create a secure environment that promotes children's well-being and development. 10. How do you handle confidential information about a child? Confidentiality is crucial in safeguarding. Only share information with authorized personnel or agencies directly involved in protecting the child. Record information accurately, securely, and promptly. Avoid discussing cases with colleagues outside of authorized channels. Explain to children and parents, when appropriate, how information will be used to protect them. Balancing confidentiality with the duty to report is key. If a child is at risk, information must be shared with designated safeguarding authorities. Secure storage, access control, and compliance with data protection laws are essential. Proper handling builds trust, ensures effective intervention, and upholds ethical responsibilities. 11. How do you handle online safety for children? Online safety involves educating children about safe internet use, monitoring online activity, and implementing parental controls or filters. Staff should recognize cyberbullying, inappropriate content, and grooming risks. Policies must guide acceptable use of devices and platforms. Children should be encouraged to report suspicious messages or behavior. Staff training is essential to respond appropriately to online incidents. Collaboration with parents ensures consistent guidance. Regular updates on emerging threats and digital trends help maintain safety. Empowering children to make informed choices online builds resilience, while proactive monitoring and clear protocols reduce exposure to online harm and abuse. 12. What role does training play in child safeguarding? Training equips staff with knowledge of policies, procedures, and signs of abuse. It builds confidence in recognizing, reporting, and responding appropriately. Continuous training ensures awareness of legal obligations, best practices, and emerging risks. Staff learn to balance vigilance with sensitivity, maintain boundaries, and protect children effectively. Interactive sessions, case studies, and refresher courses reinforce learning. Training also fosters a culture of accountability, collaboration, and ethical responsibility. It is essential for both new and experienced staff to ensure consistent safeguarding standards. Ultimately, training helps create safe environments and empowers staff to act decisively when children's welfare is at risk. 13. How do you involve parents in child safeguarding? Parents are key partners in safeguarding. Open communication about policies, procedures, and expectations promotes trust. Encourage parents to report concerns and support children's safety at home. Involve parents in risk assessments, safety planning, and educational programs. Provide guidance on online safety, emotional well-being, and behavioral issues. Collaboration ensures consistency between home and organizational environments. Address concerns sensitively while respecting confidentiality and cultural considerations. Regular meetings, newsletters, and workshops strengthen engagement. Empowering parents to understand their role reinforces protective measures. A strong partnership between staff and families enhances overall child safety and ensures early intervention when risks arise. 14. How do you ensure safe recruitment practices? Safe recruitment involves thorough background checks, reference verification, and interviews focused on safeguarding knowledge. Job descriptions should include safeguarding responsibilities and expected conduct. Induction programs reinforce policies, reporting procedures, and ethical expectations. Probationary periods and continuous monitoring ensure compliance. Training and supervision assess candidate suitability for working with children. Policies must prevent hiring individuals with a history of abuse or unethical behavior. Maintaining records and reviewing recruitment processes regularly strengthens accountability. Safe recruitment ensures children are protected from potentially harmful adults and contributes to creating a safe, professional, and trustworthy environment. 15. How do you support children experiencing abuse or trauma? Support includes listening empathetically, validating feelings, and maintaining a calm, safe environment. Children may require counseling, mental health support, or specialized services. Staff should work with families and external agencies to ensure comprehensive care. Encourage self-expression through activities or discussions while respecting boundaries. Consistency, reassurance, and positive reinforcement help build trust and resilience. Record observations accurately and follow safeguarding protocols for reporting. Avoid blame or judgment, focusing on recovery and empowerment. Providing appropriate support enables children to process experiences safely, reduces long-term impact, and fosters confidence, emotional growth, and well-being while ensuring their safety and protection. 16. How do you promote child participation and voice? Children should be encouraged to express opinions, concerns, and preferences in decision-making affecting their lives. Age-appropriate methods, such as discussions, suggestion boxes, or forums, facilitate participation. Staff should actively listen, validate perspectives, and act on feedback when possible. Empowering children strengthens self-esteem, awareness, and responsibility. Participation includes input in policy development, activity planning, and safeguarding procedures. Ensuring confidentiality and protection during involvement is crucial. Promoting voice helps identify potential risks, improves service delivery, and fosters trust. A participatory approach creates an environment where children feel respected, valued, and integral to their own protection and well-being. 17. How do you respond to repeated concerns about a child? Repeated concerns require careful documentation, monitoring, and escalation to safeguarding authorities. Review previous reports to identify patterns or risks. Engage appropriate professionals, such as child protection services, counselors, or medical experts. Maintain communication with the child, family, and staff to provide support. Evaluate environmental, social, or behavioral factors contributing to concerns. Follow organizational procedures strictly to ensure accountability. Avoid assumptions or delay in action. Prioritize the child's safety. Provide reassurance, and take preventive measures. Consistent monitoring and coordinated response ensure timely intervention, protect the child from further harm, and address underlying issues effectively. 18. What challenges have you faced in child safeguarding? Challenges may include limited resources, high caseloads, cultural barriers, or resistance from families. Balancing confidentiality with reporting obligations can be difficult. Identifying subtle abuse signs or navigating complex family dynamics may require skill and patience. Staff turnover or lack of training may impact consistency. Online risks and emerging forms of abuse pose evolving challenges. Addressing these requires proactive planning, collaboration, and ongoing professional development. Documenting and sharing experiences helps refine practices. Maintaining resilience, empathy, and ethical standards is essential. Despite obstacles, commitment to child protection ensures safety, reinforces trust, and strengthens organizational safeguarding culture. 19. How do you stay updated with child safeguarding policies and legislation? Stay informed through regular training, workshops, professional networks, and government or NGO updates. Subscribe to newsletters, attend seminars, and review research on best practices. Engage with safeguarding forums or peer discussions to share knowledge. Monitor changes in laws, guidance, and international standards. Update organizational procedures accordingly and train staff on revisions. Review case studies and reports to understand evolving challenges. Staying current ensures compliance, reduces risks, and enhances effectiveness in protecting children. Continuous learning reflects professionalism, responsiveness, and commitment to high safeguarding standards, enabling proactive identification and management of potential risks. 20. How do you evaluate the effectiveness of safeguarding measures? Evaluate through audits, feedback, incident reports, and risk assessments. Assess staff knowledge, training completion, and adherence to procedures. Monitor trends and reported concerns, response times, and outcomes. Solicit feedback from children, parents, and stakeholders to identify gaps. Review policies regularly for relevance, clarity, and compliance with legislation. Benchmark practices against national or international standards. Continuous improvement cycles help refine strategies, address weaknesses, and implement best practices. Effective evaluation ensures that safeguarding measures remain robust, responsive, and child-centered, creating safer environments and fostering confidence in organizational commitment to children's well-being and protection. 21. How do you handle conflicts between children's needs and parents' wishes? Conflicts require careful assessment of the child's best interests. Listen to both the child and parents, documenting concerns objectively. Evaluate risks, welfare, and legal obligations. Engage safeguarding authorities, counselors, or mediators when necessary. Maintain open, respectful communication while prioritizing safety. Provide guidance to parents about the importance of child protection measures. Avoid personal bias and ensure transparency in decision-making. Collaborate with multidisciplinary teams to reach balanced solutions. Decisions should empower the child while respecting family dynamics, ensuring their protection and well-being. Ethical judgment and adherence to safeguarding policies guide effective resolution in such situations. 22. How do you handle children with special educational needs in safeguarding? Children with special educational needs, SEN, may be more vulnerable to abuse or neglect. Staff should understand specific needs, communication methods, and triggers. Implement individualized safeguarding plans and closely monitor their well-being. Collaborate with specialists, therapists, and parents to provide comprehensive support. Ensure accessibility of reporting mechanisms and safe environments. Train staff on SEN awareness, inclusive communication, and recognizing subtle signs of distress. Respect dignity, maintain patience, and adapt interventions to suitabilities. Tailored approaches ensure SEN children are protected, supported, and empowered, reinforcing safety and equality while minimizing barriers to effective safeguarding. 23. What is your approach to multi-agency collaboration in safeguarding? Multi-agency collaboration ensures comprehensive child protection by sharing expertise, information, and resources. Maintain clear communication channels with schools, health services, social workers, law enforcement, and NGOs. Establish roles, responsibilities, and protocols for reporting and intervention. Participate in case conferences, strategy meetings, and joint risk assessments. Respect confidentiality while providing necessary information to relevant agencies. Regular updates, coordination, and documentation prevent duplication or gaps in safeguarding efforts. Collaboration strengthens support systems, ensures timely response, and addresses complex issues effectively. Working together creates a holistic approach, maximizing children's safety and welfare across multiple contexts and professional settings. 24. How do you promote a culture of safeguarding within an organization? Promoting a safeguarding culture involves leadership commitment, clear policies, and visible accountability. Train staff consistently, integrate safeguarding into daily practice, and encourage reporting without fear. Celebrate successes, share lessons learned, and model ethical behavior. Involve children and parents in shaping policies, and provide feedback mechanisms. Conduct audits, reviews, and monitoring to ensure compliance. Foster open dialogue, transparency, and mutual support. Address concerns promptly and fairly. Embedding safeguarding in recruitment, induction, and evaluation reinforces standards. A strong culture ensures vigilance, empowers staff, and creates an environment where children feel safe, respected, and valued. 25. How do you measure the impact of safeguarding initiatives on children? Measure impact through feedback, surveys, incident data, and behavioral observations. Assess children's sense of safety, emotional well-being, and engagement in activities. Monitor reductions in risks, bullying, or neglect incidents. Evaluate staff performance, training effectiveness, and adherence to policies. Use case studies, parent feedback, and external audits to identify strengths and areas for improvement. Continuous monitoring allows refinement of strategies, ensuring interventions are responsive and effective. Measuring impact demonstrates accountability, informs decision-making, and enhances children's protection. Evidence-based evaluation ensures safeguarding initiatives achieve their goals, fostering safer, supportive, and thriving environments for children. Effective child safeguarding requires vigilance, training, and collaboration. Implementing policies and proactive measures ensures children are safe, supported, and empowered to thrive in secure environments.